This is our 6th hearing in this Congress on health information technology and the government's electronic health records program. Senator Murray and I will each have an opening statement, then we'll introduce our panel of witnesses. After our witness testimony, senators will have about 5 minutes of questions. This is a wrap-up session. We've really been working together, committee staff on the Democratic and Republican side, and we've worked with the administration to see if jointly we could improve the electronic health care record system. Senator Murray and I were just talking a little earlier. I don't want anybody to think that the committee's goal on either the Republican or the Democratic side is not to move forward on electronic health care records. We don't want to stomp them. We want to get them right. And we might have different opinions about how to get it right, but both of us, I think I can speak for Democrats as well as Republicans on that. Over the last 5 years, taxpayers have spent about $30 billion to encourage doctors and hospitals to adopt such record systems. The whole purpose of this is to benefit patients so that they and their health care providers have quicker and better access to their health histories, and their doctors and hospitals and pharmacists can provide them with better care. Making electronic health care records succeed is essential to the biomedical research and innovation legislation that we hope to mark up and finish this year and have ready for the full Senate to work on. Number one, it's especially critical to President Obama's precision medicine initiative to assemble 1 million genomes and allow doctors to take advantage of that genomic information to prescribe the right medications in the right quantity at the right time. Doesn't make any sense to go to all this trouble to gather the information if you can't use it effectively. Number two, getting electronic health care records is important also to the shared goal between the administration and the Congress adopted in recent legislation, the DocFix legislation we call it, to change the way the Medicare program pays doctors so that Medicare is paying providers based on quality rather than the quantity of care they give patients. Under the new merit-based incentive payment system, 25% of the score that determines a provider's penalty or bonus payment will be based on participation in meaningful use and how well they comply with the regulations involved with electronic health care records. So you're not going to be very successful with a merit-based system if electronic health care records aren't working. So we're now entering a period where the government is penalizing doctors and hospitals if they don't adopt electronic health record systems instead of giving them money by incentives. Stage 1 of the system has been a success. Stage 2 is not a success. Only 12% of doctors, 40% of hospitals have been able to comply with Stage 2. The administration has revised its rules for Stage 2. Most people believe it'd be a big help to adopt that final rule immediately. I've urged that those rules for Stage 2 be adopted immediately. I've also asked the government to make the rules final for Stage 3 to require doctors and hospitals to create electronic health records no sooner than January 1 of 2017, and that the Stage 3 requirements be phased in at a rate that reflects how successfully the program is being implemented. Patients need an interoperable system that enables doctors and hospitals to share their records, but they need time to do it right. There are no reasons I've found not to do it on the schedule I've just suggested. Stage 2 now, Stage 3 in a year. And there are 5 reasons, and I won't go into detail about them, but I'm going to mention each one, to do it according to the schedule I've suggested. One is only 12% of doctors and 40% of hospitals comply with Stage 2. So rushing out Stage 3 seems premature. Number 2, I've mentioned that the merit-based payment system for doctors, 25% of the penalties or incentives depend upon complying with meaningful use. It's important that meaningful use be right. Just this week, the administration began the process to develop regulations for its value-based payment system, so it would seem to me to make sense for the final stage of electronic records to be developed at the same time you develop your merit-based payment system records. Number 3, several of the leading medical institutions in the country, and I won't name them, have recommended that we take more time on Stage 3. One of those, one of the finest, said it was literally terrified of Stage 3. That's no way to have a success. Stage 4, number 4, the Government Accountability Office this week issued a report saying that complying with the meaningful use program is taking so much time, it's going so rapidly, that it's actually preventing work on interoperability. That's the GAO report this week. And finally, we're working on legislation, which we hope that the full Senate and the full Congress will adopt next year. We'll finish, we hope, in this committee this year and adopt it next year with their 21st century cures. And we want to do in our legislation what the administration can't do administratively. And it would make the most sense to me to do that together. We're working on physician documentation, giving patients better access to their own records, encouraging the entire health team. We're working on things essential to interoperability, data blocking, certification, improving standards, security and privacy of patient records. All those things help make electronic records a better system. I said to the budget director, whom I visited with the other day and gave this advice, I said, when I was young and playing the piano, I used to like to play fast. And my piano teacher would say to me, Lamar, play the music a little slower than you can play it, and you're more likely to get it right when you have a recital. Well, my advice to the administration on this is you could go ahead on stage 3, but I would suggest you go ahead, go a little slower than you need to go, and make sure you don't make a mistake. Senator Thune, chairman of the Commerce Committee, and I wrote a letter to the administration suggesting the schedule I've just described. A bipartisan group of 96 Republicans, 20 Democrats in the House did the same. I've got 4 letters I'd ask consent to put in the record reflecting that advice, also from doctors and hospitals and others. What I'm about to say, I want to make sure isn't misunderstood, and I'll conclude and go to Senator Murray. We have an opportunity in the Congress to carefully review whatever decision the administration makes about how we proceed. One way we can do that is through the innovation legislation we're working on. Another way is through the congressional review process if we don't like the rule. But I hope one of the lessons from the Affordable Care Act is that it's better to move ahead with a consensus if you can get a consensus. You can get a consensus here. Republicans and Democrats want electronic healthcare records to succeed for the benefit of the patients of this country, and because it's critical to at least 2 of the administration's major initiatives, precision medicine and merit-based payment. So why not move ahead on a schedule that adopts stage 2 now and stage 3 in a year, and use the time between now and a year from now to develop support and build on consensus and get doctors and hospitals and vendors buying into what you're doing and go out of office at the end of the next year with a big success instead of a big problem. The big problem would be if you prematurely announce a rule and you have a lot of people who don't like it trying to repeal it from the day you do it. Senator Murray.